Our next guest is, we've got Stella Wiig, Professor Stella Wiig, who is a consultant for vascular and general surgery at Croydon University Hospital. Whilst having been appointed as National Medical Director for Secondary Care, she has also continued as National Clinical Director for Elective Care, which has enabled her to influence change across the healthcare system. And she has won awards including the Silver Scalpel Award in 2018 and the London NHS Leadership Academy Mentor of the Year Award. Without further ado, Stella.
Thank you very much. Look, I'm just Stella. I work in Croydon. I'm a surgeon, and I am really, really proud to be here today. Manju, thank you so much for the invite. You invited me last year, and sadly my father passed, so I couldn't come. And I've already seen incredible talent here today, and the panel was so powerful. And the young man who spoke from his heart, and it takes a lot to do that in front of strangers. So just a huge thank you. I don't think he's in the audience, but a huge thank you to you. So what do I do? I'm a surgeon. I'm also National Medical Director and National Clinical Director for NHS England. But that's not what why I'm here today. I've spent many years being a surgeon. Mental health has not been first and foremost as my practice. But what I have seen, that mental health affects many people, and it is not medical treatment only that makes a difference. It's the society, it's the environment, and it's the people that support each other that actually make a difference. And we have seen incredible sadness in Croydon. And if we can prevent and make sure that we've got compassion, then actually even one step in that direction from all of us will make a huge difference. So last year was quite interesting. Manju and I had met, and we found out there was a new lady mayor for the City of London. Now, she was the third female lady mayor in 700 years. And of course, I'm a female surgeon, so I'm champion females as much as I can. And the decision was made that we would take 697 women in the Lady Mayor Show, the first time, through the City of London, and that we would take 200 women from health and tech. Manju, we invited you. You brought 10 amazing, incredible youngsters with you, and their energy boosted us, old people, through the day. But I think what was really important was we showed them that they could. They walked through the City of London. They saw young people, they saw older people, they saw diversity, they saw love, they didn't see hate. They saw community, they saw compassion. As we walked, there were young children lining the streets, shouting, and our group and others in the parade were walking back, and it was just a touching of hands as we went past, and it was so powerful. And that's what our society should be. And Manju, it was an absolute pleasure having your youngsters with us at the conversation. And I think what I've really seen in the Foundation for Mental Health is it's done incredible things. So I think there's been 400 events. Manju, I'm sure there's more than that now that are being held. But I think what you are doing, what's really inspiring, is you're creating a platform for people to have a voice, for people to be heard, and for people that we've seen today, they will never forget the performances they've done in front of you and the applause that you've given them. And we have some of the most vulnerable children in London not heard and invisible going through our system and then getting very frustrated. And we're seeing the outcomes. What really stands out, Manju, with your foundation is that intergenerational approach, making sure that we've got youngsters who are supported by their community, who may be older. And it's really important. And why is that important? So I've achieved, but this is not where I started. I was born in Bangor. Mum and Dad were market traders. We had very little money in the house. But the one thing we did have was mum and dad who said that we could. Every time I lost confidence, my parents would say, yes, you can. When I failed my A-level, as I wanted to be a doctor from a very early age, I did my A-levels and I failed my chemistry, and school told me that I should become a social worker. But my dream was to become a doctor. And the community around me and my parents supported the conversation that she wants to be a doctor, she's going to be a doctor, she will repeat her A-levels, she will not become a social worker. And that's a pivotal conversation, because often our dreams are shattered because people around us tell us we can't. And it's not parents that tell us we can't, it's society that tells us we can't. And it's the subtle messages that go through that have that conversation. And we need to break that. All of us need to break that. So this program is really, really important. If we have our youngsters in the right place, surrounded and enveloped by the right communities, we won't see the harm that's being caused, harm to themselves. When we have someone who dies in our community, we think passionately about that person who's died, but actually their lives are touched by the people who have caused harm, the families around them, but also by the community that sits around them. And I had the absolute honour of meeting Baroness Doreen Lawrence 2 weeks ago. Her passion and drive, if I could put it into something and bring it with me, her passion and drive to make sure that society supports each other and our children. She has, it's really interesting, she talks about her time now in the House of Lords, and she still describes the invisibility. Isn't that incredible? This is a woman who has grown up with hurt, who has enveloped her and made a difference to society, but she's still having to find her place. Our jobs, everyone in this room, our jobs are to make sure that we don't have to do that as we go forward. So I'm going to finish with a couple of things, which is, I'm going to ask you to join in, so I'm really sorry. So to all the young people who are in the room right now, what you need to know is that we talk about you being the future, but actually you are also the present. You're the now. And what I want to hear from you all is, if I say to you, can you do something, what are you going to say back to me? I can't hear you. Come on, everybody here has been talking, singing, whatever. So let's have it all together then. If your child wants to do something, if you are dreaming of doing something, can you do it? Yes. Still can't hear you. Come on, one more. Yes. Okay, now I believe you. So Manju, we've now got a mandate to go forward. So Manju, I'm just going to say to you, you are a powerhouse. Without you, this wouldn't exist. This wouldn't be here. Your team are incredible. But what we need to get out to our communities, the conversation that, Mayor, you were just having about the networks that we can develop, that's so important. And all of us have reach into different networks. We need to coalesce and we need to envelope our children so they remain safe, but their dreams really do come true. Thank you.